Hi, I'm Stephanie Perez Carrillo and I work as the Policy and Partnerships Manager at the Colorado Children's Campaign. No Colorado kid or family should have to worry about where their next meal comes from. Unfortunately, that's not the case for many of our neighbors and kids. Nearly 1 in 3 families have reported they haven't had enough food to eat or have been hungry in the last 7 days. The COVID-19 pandemic and its effects on the economy have made it harder for Colorado families to afford the basics, including food. Even prior to the pandemic, far too many Colorado kids experienced hunger. In 2019, about 1 in 7 Colorado high school students reported that they went hungry in the past 30 days sometimes, most of the time or always due to a lack of food at home. Youth of color reported going hungry at higher rates than their white peers, reflecting long-standing barriers to economic opportunity that disproportionately harm families of color. We know that hunger has significant impacts on child development and well-being, and research demonstrates that experiencing hunger can alter a child's health, behavior, and academic performance. In fact, children who face hunger are more likely to experience iron deficiency, chronic illness, and poor health status overall throughout their lives. Among very young children, hunger is linked to delays in cognitive, motor, and social-emotional development. When they become adolescents and adults, children who experience hunger may be more likely to deal with depression and suicidal ideation. In this challenging time, food banks, school nutrition staff, and other food service providers have been hard at work to combat hunger. Essential programs like Pandemic EBT, which provides an average benefit for families with school-age children who would have otherwise received free reduced price lunches during the school year, and SNAP, have made it possible for kids and families to access food. Colorado policymakers can advance solutions to ensure all kids have access to food, and the General Assembly should maintain funding for Breakfast After the Bell and the School Lunch Protection Act. Breakfast After the Bell provides breakfast at no charge to each student enrolled in a public school that has 70% or more students who are eligible for free or reduced price meals under the National School Lunch Program. The School Lunch Protection Act ensures that schools can receive reimbursement for every reduced price lunch served. These programs are the primary tools used to combat child hunger. Legislators can also maximize investments in school nutrition programs where the federal government provides a match or reimbursement. They can also maintain funding levels for SNAP outreach and enrollment. Together, we can ensure that all Colorado kids and families have access to the food they need.
Hi, I'm Bill Jager. I'm the Vice President of Early Childhood and Policy Initiatives at the Colorado Children's Campaign. I help advance our agenda to ensure all children in the earliest years of life, birth through 8 years old, have every opportunity to succeed and have those high-quality, stimulating experiences we know that can lay the foundation for years to come. I want to highlight one of the data trends we are pointing to today as it affects children's healthy development. And specifically, that's a focus on access to high-quality preschool. Preschool represents the years before kindergarten entry, when children have a tremendous opportunity to develop the social, emotional, and cognitive skills that set them on a path to school success. We know that high-quality preschool yields benefits for children, families, and society as a whole. Specifically, research has identified benefits ranging from substantial improvements on standards-based assessments to increased likelihood of high school graduation and even improved health outcomes. The benefits of preschool are particularly strong for children living in families with low incomes and children of color who disproportionately face barriers to educational opportunity. We also know that preschool is a tremendous benefit for families. Access to preschool can help parents participate in the workforce. With more than 2/3 of children under the age of 6 having all parents, available parents in the workforce, we know that access to high-quality early childhood education certainly supports children's healthy development, but it also supports families' economic opportunity as parents pursue their careers and economic goals. A recent analysis found that labor force participation, particularly among mothers in Washington, D.C., increased by 12 percentage points since that city began offering free and universal high-quality preschool. And as Colorado moves down the path towards universal preschool come fall of 2023 after the passage of Proposition EE, it's important that we get this program right to support the needs of children's healthy development as well as families' economic security. Finally, society as a whole benefits. Decades of analysis really look at the return on investment that we get from offering high quality early childhood education and preschool in particular. The Perry Preschool Project is just one example, and probably the most well-known. Long-term studies of the effects of preschool found that society as a whole saw a nearly $13 return on every dollar invested in that program. So once again, early childhood education can lay the foundation of so much what is to come. A key facet of early care and education is preschool. Colorado is poised to be able to implement universal preschool, but we have a lot of work to do as a state to bring alignment and equity to how we ensure that all children have access to that quality experience. We need to make sure that children have access in the communities and in the programs that they value. We need to make sure that the children who face the greatest distance to opportunity see those barriers removed so that they can equitably participate in high quality preschool. And we need to relieve the burdens on providers of early childhood education who have to navigate multiple funding streams, multiple standards in order to offer full day, full year experiences for children. So we're excited to partner with the legislature and advocates around the state to ensure effective implementation of universal preschool beginning this coming session.
Hi, my name is Erica Manawato, and I work as the Manager of Research Initiatives at the Children's Campaign. We all share in the responsibility of keeping our kids safe from gun violence. When it occurs, gun violence not only impacts those who are directly involved, but it can also impact children who witness it or children who hear about it after the fact. In our state, in recent years, we've tragically seen an increase in the number of unintended injuries, deaths, and suicides by firearms among our children. Between 2013 and 2017, we saw 254 Colorado kids and teens who died due to gun injuries. And this was a nearly 80% increase in these types of deaths compared to a decade earlier. We also know that when we look at firearm deaths among our children, that the majority of these deaths are suicides, and that suicide has been named the leading cause of death among 10 to 18-year-olds in our state in recent years. This is a huge problem, but we can take a data-driven public health approach to gun safety policy in Colorado to reduce these tragedies. Child access prevention laws, also known as CAP laws, have been shown to reduce these types of deaths and injuries in states, and they do that by addressing reckless provision of firearms and also negligent storage of guns in homes. When thinking through this policy, though, it's also critical to make sure that we are not perpetuating any racial inequities when it comes to interactions with law enforcement. Together, we can put an end to these tragedies, and we can do it in an equitable and thoughtful way.
My name is Sarah Barnes, and I'm the Manager of Special Policy Initiatives at the Colorado Children's Campaign. And the good news is that Colorado policymakers can help with solutions to keep Colorado kids and families in their homes. The Eviction Legal Defense Fund is one important tool to keep Colorado families housed. The fund was created by the legislature in 2019, and it provides critical funding to support legal aid organizations who assist families facing eviction across our state. We are also proud to work together with partners like the Renters Roundtable, a coalition of advocates, policy experts, and people with lived experience, to support the work to advance a comprehensive set of policies to increase protections for renters in Colorado and keep families in their homes. Together, we can make sure that all Colorado families, particularly those facing the greatest barriers to housing security, have a safe, stable place to call home.
I'm Angelique Smith, Development Director for the Colorado Children's Campaign. It is important for every Coloradoan to have a place to call home. Before joining the Colorado Children's Campaign, I had the privilege and challenge of providing housing case management for first-time parents through the use of housing vouchers. In that role, I saw firsthand the impact of housing insecurity. Families on the brink of eviction, some homeless and overcrowded in temporary housing, and all seeking an opportunity to create a sense of stability and security for their family, and to have an opportunity to focus on life skills to improve themselves and reach their highest potential. Finding affordable housing to meet the strict restrictions of housing vouchers was tough then. Over the years, I've witnessed the housing market in Colorado with soaring rental rates and record home purchase pricing create instability for homeowners, high salary renters, and those in subsidized housing. Even before the COVID-19 pandemic, Colorado was experiencing a chronic housing crisis, uprooting families from their routines, disrupting children's education, and causing immense personal and economic stress for families. The economic crisis caused by COVID-19 is making a place to call home even more unattainable for many families. Households are forced to make difficult choices between buying adequate food and making important medical decisions just to keep a roof over their heads. The health and well-being of Colorado families depends more now than ever on keeping families housed. Sustaining and providing access to safe, affordable housing is a public health issue affecting Coloradoans from all walks of life, especially during a global pandemic. Most pressing are the 1 in 4 Colorado renters at risk of eviction as a result of the pandemic. Families with children face evictions at significantly higher rates. This was true even before the pandemic. Evictions are not only an economic security and public health issue, they are a racial justice issue. Due to the perpetual racist policies and practices that increase barriers to housing stability for communities of color, Black and Latinx individuals and families are significantly more likely to face eviction. And during September and October of 2020, Colorado adults living in households with children reported that they were nearly 3 times more likely to report being behind on rent.
Hi, Erin Miller, Vice President of Health Initiatives, to talk to you about the policies that are coming up this legislative session, 21-22, to help address these trends. So you've seen Colorado's had this sustained success in reducing unintended and teen pregnancy, and that success is really in peril because of COVID-19. So there's a number of policies that are coming up this legislative session. It's very exciting to help meet this moment. I'm going to talk through them quickly here. I'm going to tell you how you can get more information and learn how to stay up to date on all of these at the end. But I'm going to go quick and just give you an overview of each one. So there's 4 policies. Number 1, budget proposal. The governor's budget proposes reinstating all of the funding that was cut from the state family planning program during the COVID-19 budget crisis last year. About $700,000 was cut from our state family planning program to meet the requirements of the state budget during COVID-19. The governor's budget for 21-22, this coming budget year, reinstates all of that funding. Critical first step. State family planning program has significant evidence-based, low overhead costs. It's great bang for your buck. It provides services to a lot of folks across the state. So that's number 1. Number 2, we have to think about folks who've been historically and systemically cut out from our health insurance system. A big group of those folks in the state of Colorado are folks who lack access to the legal immigration system and lack proper documentation. They don't have a lot of coverage options in our state. Our friends at Calor are proposing creating a family planning coverage program, expanding health insurance access for those folks who lack proper documentation. It's another critical policy. Those folks can get coverage through the state family planning program, but in some cases they might live 2 hours from a family planning clinic. If you provide them health insurance coverage that covers family planning services, then they'll be able to get those services right in their neighborhood. So it's a great next step. Next is a policy the Children's Campaign will be leading. It will expand access to family planning services for folks who are just above the Medicaid income eligibility threshold. This is a state option. The federal government actually pays 90% of this cost, so the state only has to pay a minority 10% share. The majority of states in the country have actually taken this option because it's such a good deal, but the state of Colorado has not. So we want the state to take this option to provide this coverage for those folks just above the Medicaid eligibility threshold. And further, if those folks become pregnant, they become eligible for our CHIP program. So there's lots of evidence from states across the country that this option actually reduces costs in the long term. Lastly, you have to think about folks who have private coverage. We want to make sure that folks on private coverage can access the full array of FDA-approved contraceptive services without paying exorbitant costs. So we want folks to be able to choose the type of oral contraceptive, for example, that works best for them and be able to access that without cost sharing. Our friends at Planned Parenthood are running a bill that would establish that in Colorado. Another very evidence-based policy, when folks can pick the type of oral contraceptive that works best for them, they do better staying with it and reducing those unintended pregnancies.
Hi, I'm Bill Jager. I'm the Vice President of Early Childhood and Policy Initiatives at the Colorado Children's Campaign, and excited to share with you one of the data trends we're highlighting this year around children's healthy development, particularly in the early years. I help lead our early childhood agenda that tries to ensure that all children in the earliest years of life, birth through 8 years old, have every opportunity to have high quality, stimulating experiences that support their healthy development. And we know that for many families, one of the key features of how the family supports the child's healthy development and that family's economic security is childcare. We know that childcare is a two-generation strategy that helps support children's access to high-quality stimulating experiences so that parents can work. Before the pandemic, we know that most parents participated in the workforce, which meant that most children under the age of 6 were in some form of early care and education program, whether it be informal or formal. But we know that an important feature and something that many parents look to is ensuring that their child can be in a licensed childcare setting. Licensing offers some protection for children's health and safety and some basic elements of quality. And so many more parents seek out licensed childcare than we have licensed capacity for. And so one of those challenges that we wanted to highlight is really the decline in childcare that we've seen and the lack of availability of childcare that existed even before the pandemic. Colorado's childcare system was fragile before COVID, and most communities lack enough slots for children in childcare and in licensed settings who need care. And we know that Colorado children under 6 likely in need of childcare, that only about 58% of children under the age of 6 have access to a licensed slot. That leaves nearly half of children under the age of 6 who likely need access to a licensed slot so that their family can work without one. That means that we need to do more to ensure that children who do not have access to licensed care are also getting high quality stimulating experiences in their family, friend, and neighbor settings. But it certainly means that we have a lot more families who are seeking out licensed care than we have available care. And so we can do things to ensure that licensed childcare is available in more communities throughout the state. I want to highlight that those statistics around the lack of availability of childcare were true prior to the pandemic, and if anything, have gotten significantly worse, and that we are, of course, very concerned about how this sector, the childcare sector, will rebound as a result of the challenges it's faced. The COVID-19 pandemic exacerbated existing challenges in our sector, and a study by our colleagues at Early Milestones Colorado, conducted in the summer of 2020, had found that 10% of childcare providers had closed their doors, and that enrollment had decreased by more than 50%, impacting communities around the state. The question is, what can we do to build this sector back stronger? Certainly, the investments that the General Assembly has made as a result of the special session will help. We know that there's federal relief coming. It's inadequate, but it's helpful in this moment. And so those are helpful things. But we also know that public policies, not just public investments, but public policies around the provision of early care and education can have an impact as well. So specifically this session, we're excited to look at the regulatory burden that family childcare providers in particular face. People who open their homes, go through the process of becoming licensed by the state, quite often face additional burdens imposed at the local, county, or municipal level that can make it very difficult to operate these small businesses. And so we want to make sure that any regulations we set to protect fire, life, health, safety, also protect, are balanced against the additional layers that make it hard to offer childcare services in one's community and in one's home. In addition, we know that childcare relies on the early care and education professionals who do this work. These are overwhelmingly women, disproportionately women of color, and inadequately compensated for the work they do. And we think investments in recruitment, retention, and compensation are key to making sure the early care and education sector thrive and more families who are seeking out licensed childcare are able to access it.
My name is Sarah Barnes, and I'm the manager of special policy initiatives at the Colorado Children's Campaign. Every child should have access to the mental and behavioral supports they need. Yet 52% of district and school leaders reported being concerned about student emotional supports last fall, making it the most common concern cited by leaders across the state. The disruption and social isolation of the COVID-19 pandemic is likely to only exacerbate mental and behavioral health issues for kids. Before the pandemic spread across the country and in Colorado, many of our students were already facing mental and behavioral health crises. In 2019, over 1/3 of high school students reported that they felt sad or hopeless almost every day for 2 weeks, a hallmark symptom of clinical depression, according to results from the Healthy Kids Colorado survey. Symptoms of depression were disproportionately high among Colorado's female students, multiracial students, Hispanic, Latino students, and Native Hawaiian students. Symptoms are also disproportionately very high among students who identify as gay, lesbian, or bisexual, as well as those who are unsure of their sexual orientation. In recent years, suicide has been identified as the leading cause of death among all Colorado youth between the ages of 10 and 18. Results from a CDPHE report indicate that boys, non-Hispanic white teens, and Black teens saw the highest suicide rates. Of the suicide deaths where there were known contributing factors, mental health concerns and a current depressed mood were most common. Recent local research in Colorado communities identified the following risk factors for teen suicide: social media use, cyberbullying, a lack of a sense of resiliency to deal with challenges, and exposure to instances of adult suicide.
Hi, I'm Stephanie Perez-Carrillo, the Policy and Partnerships Manager at the Colorado Children's Campaign. Understanding and meeting the mental and behavioral health needs of all kids is critical, and promising research finds that school-based interventions, as well as those delivered in other community settings, can have significant positive impacts. These interventions include conducting universal screenings, ensuring all schools have full-time access to a school counselor and school psychologist, training teachers on how to identify and support student behavioral health needs, and offering individual counseling services. Colorado policymakers can advance policies and creative solutions to ensure all kids have access to mental and behavioral health supports, and the General Assembly should support and pass legislation that broadens access to mental and behavioral health services, preserve funding for the Healthy Colorado Kids Survey and the Smart Source Survey, which provide a comprehensive understanding of child health and well-being in schools, particularly during this unprecedented time for students and families.
Hi, Erin Miller, Vice President of Health Initiatives here at the Colorado Children's Campaign. Here to talk to you now about kids' health insurance coverage. Health insurance coverage is critical for Colorado kids. We know that it reduces maternal, infant, and child mortality rates. It improves physical and mental health in kids. And we know that kids with health insurance, especially publicly financed coverage, are more likely to finish high school and college and have higher incomes as adults, so they can really chart the futures that they want. And we have some concerning news here, that going into between 2018 and 2019, we saw the largest single year increase in kids without health insurance coverage in more than a decade. 10,000 additional kids lacked health insurance coverage in 2019. And that brought our 2019 totals of kids who don't have coverage to 73,000. There were 73,000 kids in 2019 going into the COVID-19 pandemic, but before the pandemic had hit, who lacked health insurance coverage. So those kids don't have access to healthcare services the way that folks with insurance do, and they don't have the financial security that health insurance brings. And so 73,000 kids lacked coverage. That's enough to fill almost every seat in Mile High Stadium. And those are our friends and our neighbors who didn't have access to health insurance coverage going into the COVID-19 pandemic and went in with that additional stress. And so what can we do? What policies are coming up? There's a number of things happening at the federal level. So we know that some of the reason for the increase in uninsurance in the state was due to racist and anti-immigrant rhetoric from the Trump administration. And so we can hope that with a transition to a new administration, that rhetoric decreases and we see an increase in coverage through this new administration because they are supporting the idea that folks who are eligible for coverage that are immigrant neighbors and friends, that they should sign up for the coverage that they're eligible for. So that's one piece. We can also hope that the new federal administration supports outreach and enrollment funding. The Trump administration cut that funding. We can also hope for supportive policies that really help state Medicaid agencies expand access to Medicaid and CHIP, that they're not worried about funding being clawed back in the back end, so that it really helps support our state agencies. So there's a number of things happening at the federal level. Also at the state level, there'll be a number of proposals moving through this legislative session to help reduce the cost of coverage. One of those, there's likely to be a public option proposal of some form, and so we'll be working with you all to ensure that there's engagement to really elevate the needs of kids and families as that proposal moves forward and make sure it provides good coverage for kids and families in our state. Lastly, a policy that passed last year, Senate Bill 215, the Health Insurance Affordability Act, that's being implemented now. There's a board that's making critical decisions about how that law is going to work. And we need folks informing that process. We need folks raising the voices of kids and pregnant people and people who could become pregnant and families as that law is implemented. And so we'll be reaching out in the coming weeks and months with information about how to get engaged in that implementation.
Hi, I'm Leslie Caldwell, the Vice President for Education Initiatives at the Children's Campaign. We advocate for a modernized and more equitable school funding system that puts kids at the center. Across our state, the funding that's available for public schools depends on local property wealth, and that means that the educational opportunities that are available to our kids differ based on where they live. This does not reflect our values, and it's not equitable or sustainable. Because we haven't had a statewide solution to our funding challenges since the last recession, districts have devised 178 local solutions with what are called mill levy overrides. When these are passed by voters, overrides generate additional funding that stays in a school district but does not impact the level of state funding that a district receives. So our investment in Colorado students varies significantly across districts, based really on two factors that are essential for districts to raise real revenue at the local level. One, you need willing voters, and two, you need real property value. The amount of funding that has been approved locally by voters has more than doubled in a decade, from $580 million in 2010 to more than $1.4 billion in 2020. Unfortunately, we know that this funding does not benefit all students equitably. We have 52 of our 178 school districts that have zero mill levy override dollars to offset funding cuts, while we have 37 districts that have more than $2,000 additional funding per student, and we have 11 districts that have more than $3,000 per student. It's not a coincidence that our high property wealth districts are much more able and more likely to support their students with overrides. In Fountain School District, 1 mill raises $21 per student, while in Pawnee School District, 1 mill raises nearly $7,000 per student. On average, our lowest property wealth districts tax themselves at 5 times the rate of our high property wealth districts, and they still only generate half of the revenue of our high wealth districts to support their students. It is our kids ultimately in our communities with lower property values that suffer the difference. Since 2010, the budget stabilization factor, or the BSF, as you will hear it called, has been an annual percentage cut that's been applied to districts. Especially in these difficult times, an equal cut only amplifies inequities and reduces the impact of funds that we devote to our students who are living in poverty, who we know now need those funds more than ever. Policymakers, luckily, can interrupt some of these harmful practices in how we resource schools and students and support communities that struggle to find adequate funding to meet student needs. As you face important budget decisions this session, we ask that you use an equity lens to target resources where they're going to make the biggest difference for kids. This could mean accounting for local voter-approved mill levy override funding as a factor in how funding cuts are applied. And it could also mean using targeted solutions, such as adjusting specific school finance formula factors instead of making across-the-board cuts through the budget stabilization factor.
Hi there, I'm Riley Kitts and I work as the Government Affairs Director here at the Colorado Children's Campaign. Our organization believes strongly that every child should grow up in a safe home where they are supported in their physical, social, and mental well-being. However, the rate of child abuse in our state has risen in recent years, marking a pretty disturbing trend for Colorado. In 2018, Colorado's child abuse rate rose to 9.5 victims out of every 1,000 children under the age of 18. That's the highest child maltreatment rate seen in our state in nearly 2 decades. Now, maltreatment can happen to kids of all ages, but young children and children with disabilities face an increased risk of abuse. And for families, social isolation and parenting stress, which we know may be exacerbated by the COVID-19 pandemic, can also serve as risk factors for abuse to happen at home. Experiencing abuse and/or neglect can impact a child for their entire lifetime. Experts predict that instances of child abuse may be increasing during COVID-19. Despite this anticipated increase, however, earlier this year, calls to the state's child abuse hotline actually fell by more than 45%, which may be driven by the fact that children are no longer seeing teachers and other mandatory reporters in person or as frequently. We know that when families have their basic needs met, like an adequate supply of nourishing food, stable housing, adequate income, access to healthcare and social services, and access to supportive environments like childcare or the classroom, abuse is much less likely to occur. We can all work together to make sure that Colorado provides for the basic needs of families during this trying time, during this pandemic. This includes ensuring families have access to safe, quality, affordable housing without having to move frequently, and access to income supports to support economic security for the family. It also means including and ensuring that families have enough nourishing food to eat, even if they experience reduced hours at a job, or making sure that kids have enough to eat even if they can't attend their school in person, where they may have been getting their breakfast and lunch and food for the weekend beforehand. And it really means prioritizing schools and childcare sites for reopening in order to support families fully and ensure that children have access to in-person trusted adults outside of their immediate family. Those settings, schools and childcare centers, are vital, and we know those should be prioritized over other things like bars, restaurants, and gyms. You can learn more about the Children's Campaign and our work and what we're doing with other partners in the community at coloradokids.org. And also be sure to follow us on social media, including Facebook, Instagram, and Twitter. And lastly, but not least, follow our podcast, The West Steps. You can find it on your podcast app or wherever you listen to your podcast. Be sure to check us out. Last but not least, sign up for Kids Flash. It's our weekly newsletter so you stay in the know. Thank you for taking the time. We'll see you later.